Hi, my name is Wanda Borges, and I'm a professor in the School of Nursing and the College of Health and Social Services. I also serve as the Associate Director of Graduate Programs, and I'm an NMSU alum. I received both my bachelor's and master's in nursing from NMSU. I then went to University of Texas Health Science Center at Houston for my PhD, where I conducted research on self-care behaviors in chronic disease. So really focusing on chronic disease self-management, because 90% of the care that happens or more isn't what healthcare professionals do or provide to the patient, it's their self-management. And so I really wanted to focus on self-care behaviors and how to improve those. And so I conducted a study for foot self-care in patients with diabetes as they came into the emergency room for non-urgent care. And we actually found that we had improved self-care behaviors in foot self-care at the follow-up. But we also found that while 90% of the patients had a primary care provider, only 30% of them had ever received diabetes education. And this was a real surprise to me, because my assumption was that if they had diabetes education or a primary care provider, that they would attend it and have the education. So that led to a study that actually looked at the factors associated with the use of diabetes education resources in a federally qualified health center. And in that study, we found that health centers, the clinics that actually had an active promotorial program in diabetes education actually had higher rates of diabetes education attendance, which really makes sense. But what we found is that while this was true, the explicit work of the promotoras was really not articulated in the clinic environment. And so there's some work to do on providing education to providers about the resources that the promotoras provide to patients and communicating that. And so we worked on that, and we actually developed another intervention that was a tailored diabetes education intervention that worked with promotoras using community-based participatory research. And in that, we were able to improve goal attainment for self-care behaviors in patients, and it was very successful. So, and continues today in the clinic. And so 7 years ago, I actually moved to San Francisco and took a position at the University of San Francisco. And in that role, I developed intentional academic practice partnerships with healthcare agencies and community agencies that served people in the Bay Area. And that work was really exciting, and I was able to use a lot of the community-based participatory research principles that I had used in my research in here in southern New Mexico. But what wasn't clear is the outcomes that come from these academic practice partnerships. And I felt that this is something we really need to articulate and be able to document, because academic practice partnerships are really the way for us to have our students engage in real world work while they're learning how to lead in the healthcare environment. And so my research interest now is really focused on the outcomes from academic practice partnerships. And there's some tangible outcomes that we can measure related to patient outcomes from direct student projects that they engage in while they're students. But there's also intangible benefits that we know occur through these partnerships. And those are the things that I'm really interested in, things such as the changing culture. There's also the transition of that student who perhaps does a project at that agency into the workforce in that agency, and then time to train, and some of those sort of cost factors that we could maybe demonstrate a benefit for these academic practice partnerships. I'm also very interested in looking at outcomes associated with interprofessional education, and are we really making a difference in patient outcomes because we're doing this interprofessional education, and how are we changing the culture through these interprofessional education efforts? How is the culture changing in healthcare organizations because of that? So if you're interested in working on any of these, I'd be happy to talk with you. Thank you very much.